Hello and welcome to Stories That Inspire Action. I am Lisa Karuru, and today we will embark on this journey talking about the world of digital health. But before that, please remember to subscribe to my YouTube channel and hit that notification button to engage in more of these powerful conversations. Without further ado, I would like to welcome our very special guest today, Dr. Steve Adudans.
Thank
How are you doing, Dr. Ree?
I'm fine.
So, Dr. Steve Adudans is a trained public health and infectious disease specialist with over 10 years of global experience. He is the founder of Gear Health, a global health tech company.
Yeah, thank you. So Gear Health is, and thank you for the wonderful introduction. Gear Health Systems is a health technology company that is bridging the gap between patients, providers, payers, and other partners. So what we do at Gear Health Systems is we make it easier for patients to be able to access to health products and services so that they can have better quality products, better quality services, especially when it comes to what we call non-communicable diseases. Now, this was born out of the COVID pandemic, where many patients who had diseases like diabetes, cancer, hypertension, they could not get access to their medicine when they needed it. And for those who had COVID and also had hypertension, diabetes, they had almost 50% chance of dying because of that double infection and disease. So for us, we see this as an opportunity to be able to make it easier for the patients and families to access their medicine, even whenever there is a challenge like a lockdown during a pandemic. And we do this through a digital platform. We have an app called G-Sort, which means get sorted, or sharing is Kujisort. So you're able to access a marketplace, get connected to a healthcare provider, and also be able to fulfill your prescription and get other products that are for wellness. Our focus is mainly non-communicable disease, but we also cover wraparound services for health and wellness.
All right. On that note, there's been a lot of discussion. I see your company is really incorporating technology,
Yes.
And there's been a lot of discussion on telemedicine, digital health, and the incorporation of artificial intelligence in the healthcare system. And in your opinion, do you think this will lead to a change in how the healthcare workers will be absorbed in the job market? And if so, do you think individuals in healthcare should upskill? And what areas should they focus on so that they may remain competitive and relevant in the job market?
Yeah. So what happens is that health as a sector has not evolved as faster as the other sectors. I'll give you an example. When you look at the transport or logistics sector, nowadays you can do your check-in on your phone. You can go and show your check-in to if you're traveling by air. That is, you show your boarding pass, or you even swipe it on a teller machine. And you're checked in without any human interaction, okay? Yeah. So health has not reached there yet, and I'll tell you why it has not reached there yet. When you look at the banking sector, a lot of banks, when ATMs were introduced, a lot of bank branches were closed.
Yeah.
After ATMs, we went into mobile money. When things like M-Pesa came, more bank branches closed because you could do your banking even beyond hours, because back in the day, banks would close at 3 p.m. After 3 p.m. you can do nothing. ATMs came, now you could go to the ATM, the automated teller machine, to get your money around the clock. And then smartphones came, now you can even do it in your bed. You can transfer money and pay people, okay? So banking, logistics, all those sectors are far more advanced, okay? Now, when it comes to health, the challenge is there is something we call private health information. Yeah. And private health information requires the need to be data security. Now, the challenge we have now with health as we move forward, most medics need to know how to handle private health information. So one needs to upskill. How do they handle their patients' information so that it's confidential, it's safe, it's secure, so that patients or customers for that, or clients for that matter, actually feel much more confident about it. I mean, if my boarding ticket was splattered on the internet, I would care less. People will know probably I went to London, okay, which is good. But if my lab results were splattered on the internet, that's something different, right?
Yeah,
you understand?
I do.
You understand, yeah.
Yeah.
So things like private health information are very important. So upskilling on knowing how to protect patient data is one of the ways I think would be very, very critical.
What is your view on things like virtual reality,
Yes.
artificial intelligence? We just saw WHO releasing an AI-based health worker called Florence 2.0.
Yes.
Yeah, so what is your view on this? Should the healthcare workers look into such things, virtual wards?
Yeah, definitely. I think for AI, it's AI and machine learning, okay? So that means that it learns on what is fed to it, and then it takes a life of its own. So most healthcare workers right now need to be the ones who are inputting the knowledge into these AI systems. So whatever I learn in class, I'm able to input it into an AI system so that the machine can learn and can be able to aggregate all this input data that has been input into it, so that it can get out something that actually would not be wrong, for patients. Okay, so I would say, by and large, on the advantageous side, it helps in reaching those who cannot be reached. So if there is a patient who is in a far-flung place, but they can access a mobile phone or they can access a computer, then it helps increase access. Okay. On the flip side, there are questions of ethics. Who actually takes the blame or the liability if a wrong diagnosis is given by a machine? Is it the person, the programmer? Is it the government or the regulator? Okay. Is it the doctors actually who actually input the data that the machine learned? So questions of ethics still exist. Okay. But also on the advantageous side is that less mistakes can be made, because as medics, sometimes we get tired and we make wrong decisions, okay? So a machine will not get tired because it is programmed with an algorithm. So it won't get tired. It will just do the same thing because it has an algorithm to go through. So what do I see as the future? I see this AI and machine learning as an aid for doctors, for nurses, and all medical practitioners, to help them not to make mistakes, okay?
Right.
So what I would call a clinical decision support system. So even as a medic, I would probably want to consult the AI and let it aid me in making my decision. So I would say the best way to look at it is see it as an aid to make your decision become much more better and much more efficient.
All right, so it's a tool,
yes,
not something that's eliminating
healthcare
workers.
It's
because
not replacing it.
yeah. So I was actually having a conversation with my father the other day, and I was telling him about all this artificial intelligence and the growth in the digital healthcare space.
Yeah.
And he was like, Lisa, you don't need to worry about these things. This is not happening in this decade or anytime soon. So what are you upskilling for?
Yeah.
And I realized it's a mentality with many of healthcare professionals right now, healthcare students. No one's really thinking about, whoa, there's this whole new space and doors opening for us. So how soon do you envision the healthcare system in Africa embracing and integrating artificial intelligence and technology in their day-to-day operations and patient care practices?
Have a very youthful population. I would say Africa is about almost 45 to 50% population that is less than 35 years. Kenya, almost 60% who are less than 35 years. These people have embraced technology as fast as they can. These people are on TikTok, all these social media platforms. So that means healthcare will adopt the same way that the other technologies are adopting to the population, to the users. So telemedicine will catch up as faster because the population is able to use these technologies. The youth embrace technology faster because that's how they've been brought up. Those who are brought up in days of analog, they take much longer. They want to see the doctor physically.
Yeah.
They want to feel the doctor and see, is this doctor, have they schooled, you know, things like those. But the youth are comfortable speaking through a screen. So I think it's going to be probably much faster than it was in the last decade. Only that what will make it slower is our capacity to be able to have the infrastructure and the training to maintain these technologies. So for Africa, we may take a bit longer if we do not have programmers, software engineers, and also the software infrastructure to maintain it. That will be the challenge. Now, something that I want to say also that is very interesting is that we also don't have a stronger regulatory framework. So if we do not have the regulatory framework faster, then we'll still be slower. So those are the rate limiting steps, I would say. Otherwise, if those things are in place, then we can move much. We're good to go. We'll take off. I can see many countries that are likely to take off faster: South Africa, Kenya, Egypt, Morocco, Nigeria, Ghana. Those countries are likely to take off much faster because of how they embraced the other technologies.
All right. So what are your thoughts on the WHO's estimate? It projects that there will be a shortfall of 10 million health workers by 2030. Do you think that's attainable because of, you know, of course, incorporating artificial intelligence? That cuts down on some man labor.
Yeah.
So what are your thoughts on this? Do you think this is doable? Is the time now for people to start upskilling, or like, what are your thoughts?
I think the shortfall has always been there, and especially for countries like in Africa, we'll continuously have a shortfall because we do not have our medical schools are still not yet there to be able to have quite a high turnover. Similarly, also the wage system for for technical people is not where the West is. Yeah. So that means that we'll continuously still have a bit of a shortfall as we move forward. So the only way for us to go there much faster is to adopt a system where we make it easier for those who have a merit-based system, where those who are able to get to these schools are able to get the best education, and those who can pay for it can be able to pay for it in an affordable and equitable way. But if we make it difficult for people to to get into medical school, then we're still going to have the same shortfall. Similarly, also is the West is going to be still attractive, okay, for these people. So if I study in Kenya, I get poached by an international organization, I'm likely to choose that, okay, because people want to go forward in their careers. So that market force will always be there. People will always have to choose what benefits them because they want to go ahead in their careers. Nevertheless, technology plays a bigger part to help us be able to reach those who cannot be reached, to reduce the labor shortfall that exists. Yeah.
Right.
Yeah.
So let's talk more about Care Health.
Yeah.
It is a company which has embraced healthcare and technology. So what are some of the challenges that you've encountered? Are people willing to, accommodate this change in delivery of healthcare and how you do your things? Or people have actually embraced the whole idea?
I think it's slower. I would say most of us find it a lot more slower to embrace technology that is new. And like I said, healthcare is still lagging behind, excuse me, as compared to banking and also logistics and transport. So because the immediate benefit of using those technologies is you can actually feel it. For health is a bit much more complex because there are many players, okay? So we're looking at the user journey. So one of the things that we had to do at Get Health is look at the user journey. Right. How do you make it simple? Mm-hmm. How the user actually, by the time the average time for somebody to determine whether they're going to use an app is 60 seconds. So if I download an app right now, so if I download an app right now and I start using it, if I face any challenge, I'm going to actually delete it.
Yeah.
Okay? Yeah. Okay. So that is a problem. I'm installing the app because I don't see it giving me value. That is a study that has been done. So to make health apps become much more user-friendly is actually the challenge. That's a challenge that we face because health has to be smooth. Okay. Now the other challenge is who pays for health. You know, if I'm traveling from Nairobi to Kampala, I'm the one who's going to pay for it. Okay. Yeah. So I'll just say Nairobi, Kampala. If it's a flight or if it's travel, what is the M-Pesa number? I pay, and I know the time. I'll go check in. Blah blah blah. Okay. Health. My goodness, who pays for it? The insurance. There's somebody else who probably wants to pay for who pays for your healthcare, right?
Yeah.
Or it could be you yourself, or it could be the national government, whether it's NHIF. So can you imagine all these players? How do you bring them together?
I get it.
How do you bring them together?
Yeah.
So if I want to get a mental health counseling. This mental health counselor is charging probably 3,000 shillings. I only have 500 shillings. I want to see, can my insurance pay? The insurance will take probably 2 hours to approve. What platform will they use? They want me to go and physically fill a form, you know. So the user journey has to be very, very easy for us to embrace healthcare. And that is a challenge that we face right now. If we're able to make the user journey as simple as possible, with a very little snag and the turnaround time, then most people are going to actually embrace it. Okay.
Yeah.
Now the other challenge is making a platform that is that has multiple options. So if it is an app, that means somebody has to access internet, right? Let's say I'm in a place where I cannot access internet. How do we make it user friendly or accessible? USSD platform. Can you have a USSD? And you've seen how, if you look at whether the journey will just be the same as the banks. The banks have apps, they have USSD platforms, like that for everybody. So how do you make it also easier for those who just need a USSD platform? They can access anything they want, or even just a call with an automated voice or something like that. So those are the challenges that we face, and we do hope that with time, especially the user journey, shall be much more easier with little pain points for patients. Yeah.
So are you getting any support from the government in terms of implementing these strategies and in terms of because we have witnessed that we know that tech will definitely improve primary healthcare,
absolutely,
the delivery, timely healthcare. So is the government supporting you in any way?
I think the government usually, their role, and I would say much more on the side of implementation, their role is mainly on regulatory. So having a policy that is friendly, having a regulatory framework that ensures that we are able to implement some of these digital tools. So right now, at least the Data Protection Commission has issued guidelines for how to handle data. The data has to be domiciled in the country that you are actually operating, and you need to have certain level of data security for you to be able to collect the information. Secondly is the government can also be a consumer of these digital tools. That's a part that we are having a problem. Okay. So the government is not yet at that point that it's able to buy the digital tools. So they still need support from funders, from donors, to be able to help them have the phone which you carry anywhere you go. So that means access to information, access to ideas is much more faster and easier. So if you have an idea, look at it. Can you develop it to be something that can be pushed to the market? Can be something that can help solve a problem, okay? Because a lot of problems still exist. So students right now think of solutions. What can you do? What can you use technology for? And how do you make it easier for your patients looking into the future? And also, you know, clinical decision support systems are still not yet there for our system. So I think that's a good area that medical students should go into. So developing clinical decision support systems to help it easier and faster to see patients. The time to diagnosis, time to treatment, all those need to be shortened. Okay,
Yeah.
you've seen those.
Definitely.
Yeah, time to diagnosis. We
Yeah.
see patients who are diagnosed almost 1 month down the line, something that could have been diagnosed faster. Time to treatment, it takes almost another 2 weeks, 3 weeks
Yeah,
for them to get
patients moving
treatment.
from one place to another.
You see, yes.
Yeah.
But if you have technology, then it will be good. Lastly, for me, is sharing information. We need to have, for students who are coming in, for us, we are the old school. We'll try as much as possible to keep up with you guys, but sharing information has become a challenge. So if you guys are going to be able to have a way that you can share information about your patients, then become easier to manage a patient. The patient doesn't have to get a battery of tests every time they see a new clinician. Is how do we share information as a community of practitioners so that the patient gets the best service with less pricking, with less you know, red tape for them to get the best service. Yeah.
All right.
Yeah.
Thank you. That was so powerful. Thank you for your valuable insight.
Thank you too, and thank you for inviting me to your show.
Wow.
Yes.
I definitely have learned a lot. I hope our viewers have. So yeah, to our viewers, thank you for being here with us. I hope you found this very informative and inspiring like I did. Please remember to subscribe and hit the notification button for more of these talks. If you have any questions on the topic or topics you would like us to talk about, comment down below. Yeah, and thank you once again for coming and making time. It has been a blast.
Thank you.
Yeah.
Thank you.
And until next time, cheers.